The experts that care for you at Des Moines University Clinic are more than just clinicians. They're researchers, teachers, and mentors who are training tomorrow's healthcare professionals. Call today or visit dmu.edu/clinic.
Hi everyone, thank you so much for tuning into the 50 and Better Fair this year. This presentation will be on bone health and osteoporosis, and it was created by the Internal Medicine Club here at DMU. So to start off with, what is osteoporosis? Osteoporosis is when bones become more brittle and more prone to fracture due to decreased density of the components that make up bones. This can happen in any bone in your body, but most often manifests as a hip fracture or a vertebral fracture. This can occur just with age, just the normal wear and tear on the body. This also occurs with hormone changes in the body. For instance, post-menopause, women will have less estrogen in their body, and estrogen is really important for bone health and bone strength. Another example would be less testosterone with age. So why is bone health important? Well, increased risk of fracture makes the potential of the results of a fall much more dangerous. So unhealthy bones are at a much higher risk of fracture, and something that might have just normally been a really minor slip, or maybe you caught yourself on the wall as you tripped, can turn into a fracture, which potentially could lead to a surgery or a hospitalization, and otherwise a disruption of daily life. So keeping bones healthy allows for the continuation of daily life activities, which is really important to all of us. When to see your doctor about bone health or osteoporosis? Well, following a fall, it's very important to see your doctor. Make sure you don't have any fractures that have been undetected. It's also really important to talk to your doctor if you have any explained back pain. This could be due to a vertebral fracture you didn't know you obtained, or any other fracture that it just might be hiding. It's really, really important to have your annual physical every year, and be sure to, even if you have no evidence of a fracture or any thing that's gone wrong with your health, it's really important to have the annual physical. And at this physical, be sure to discuss any family history of osteoporosis or any new risk factors you might have. So I wanted to discuss some abnormal findings that you might encounter when you're at the doctor's office if you were to get screened for osteoporosis to just check up on your bone health. So a few things that you might hear about or you might see the values recorded would be, first of all, a dual energy absorptiometry scan. This is often called the DEXA scan. This scan measures bone density. So a DEXA scan gives a T-score, and an abnormal DEXA scan would be a T-score of -2.5 or below in the lumbar spine, so that's your lower back, the femoral neck, which is the neck of your femur bone, or your hip. If your physician were to find that you have a DEXA scan that's -2.5 or below for a T-score, they might help you with some supplementation or some prevention methods to make sure that they can hopefully resolve the bone density issue so that they can maybe prevent any fractures. Because again, a DEXA scan is all about measuring bone density, and decreased bone density is what can lead to an increased risk of fractures from really minor traumas. Another value you might see recorded at the doctor's office would be 25-hydroxyvitamin D. So this is a hormone that's found in your serum, and it's found after another version of vitamin D has been modified in your body. So if your physician were to find that this level was below 30 nanograms per milliliter, that would be concerning. We want 25-hydroxyvitamin D to be between 30 and 50 nanograms per milliliter. This might indicate that you have a vitamin D deficiency, and vitamin D is incredibly important in bone health and maintaining bone strength. So if your physician were to measure 25-hydroxyvitamin D and find a low value, they may also help you with some supplementation, some prevention methods. That just may be one way they measure your bone health. Another thing you may be discussing with your physician would be a fragility fracture. So this is defined by the American Association of Clinical Endocrinologists as a fracture that is due to a fall involving a force similar to the force of falling from a standing position that would not have fractured a healthy bone. So like I mentioned earlier, this could be just kind of falling into a chair, or tripping and falling into a wall but catching yourself. Things that are really, really minor traumas that generally wouldn't fracture a bone, but did happen to fracture a bone in this instance. So if you had an x-ray done and found a fracture that you don't remember getting, this could be a fragility fracture. And this could be a sign that you maybe have decreased bone density and maybe some osteoporosis. Another thing that kind of goes along with that is any unexplained pain for minimal trauma or daily life activities could indicate that there's a fracture that is hidden somewhere in your body, that's just kind of being masked by something. So I want to talk a little bit about how to know if you're at risk. The age threshold for the risk of osteoporosis is age 65 and above. Anyone who's had prior fractures is a little bit more at risk for osteoporosis and should have that worked up by their doctor. Early menopause is a risk factor, and this is because early menopause would just indicate that there had been a longer amount of time that a woman hadn't had the normal amounts of estrogen in her body, which again is really important for bone health and bone strength. A low body weight, which is defined as less than 127 pounds. Rheumatoid arthritis. Decreased kidney function, and this is because the kidneys are really important for the conversion of different, like vitamin D, for instance, or different hormones. So decreased kidney function could have implications on bone health. Malabsorption conditions, sustained use of glucocorticoids, and these would include things like prednisone or hydrocortisone, and then hyperparathyroidism. Now I want to talk a little bit about some prevention methods. So according to the American Association of Clinical Endocrinologists, alcohol intake is an important prevention method. So they define it as no more than 3 drinks per day. They also talk about avoiding smoking or smoking cessation. Another really great way to prevent osteoporosis, and that's often in control for a lot of people, is an active lifestyle. So it's things like weight-bearing exercise, things like walking, jogging, balance or resistance training. Tai Chi is a really popular exercise activity that's weight-bearing and that can be very beneficial for bone health. Stair climbing is often recommended, or even things just like posture exercises to make sure that you're strengthening your back muscle so you can help out your bones as much as possible and hopefully avoid any fractures in your back. So some more prevention methods. Dietary calcium intake is incredibly important in keeping your bones strong and healthy. So specifically, the recommendation for women ages 50 to 71 is 1,200 milligrams of calcium per day. For men ages 50 to 71, the recommendation is 1,000 milligrams of calcium per day. And then for both men and women ages 71 and older, the recommendation is 1,200 milligrams of calcium per day. So you can obtain this in your diet from any dairy products, things like milk, cheese, or cottage cheese. Nuts and seeds are also very calcium rich. So that picture on the right kind of gives some good examples of some calcium rich foods. Another really important method for prevention is vitamin D3 supplementation. So specifically, it's recommended 1,000 to 2,000 international units. Another way to get vitamin D3 besides in your diet, and that's free, is from the sun. So taking a walk outside maybe 2 to 3 times a week would help you get some more of that vitamin D3 and would also help with the exercise component of bone strength and keeping your bones healthy. Beyond that, adequate protein intake is also very important. So the recommendation for protein is 0.8 milligrams per kilogram. And then lastly, limiting caffeine is also really important. So keeping that to 1 to 2 drinks per day because this will increase your ability to absorb calcium. So I want to note before moving on from this slide that it is always extremely, extremely important that you talk to your doctor before you begin a new supplement. So if you're on any supplements at all or on any multivitamins or anything like that, it's very important that your doctor knows before you start any new supplements. If you were to increase your calcium intake, this could possibly interfere with any medications you may be taking. So it's very important your doctor knows before you start a new supplement or if you're on one now or anything like that. That's all I've got for today. Thank you so much for tuning in. If you'd like any more information on bone health or osteoporosis, a couple websites I've listed here. In the Office on Women's Health in the United States Department of Health and Human Services, there is the website there. And then the Mayo Clinic website is another great resource for prevention, when to see your doctor, dietary supplements, all things related to bone health you can find there. Or again, just talk with your doctor. They should be able to help you design a plan that fits just right for your lifestyle and just right for your health. Here are my references, and thank you so much again for tuning in, and enjoy the rest of the 50 and Better Fair this year.
Moines University Radiology offers imaging services to our patients and outside referrals. In addition to traditional x-rays, we offer state-of-the-art imaging technologies for measuring bone mineral density and body mass composition. One of the imaging services in high demand is body composition analysis, or BCA. Our simple scan measures a person's total body fat composition as well as the ratio of lean mass to fat mass in each arm and leg, the head and trunk. If you want to stay in good health, this will provide you with a detailed analysis of your body, including measurements of true body fat percentage, ratio of fat to lean tissue, and color-coded body mapping. Because BCA analysis is considered the gold standard in measuring the body composition, people often use the information when planning a workout routine, changing diet, or making a lifestyle makeover. Too much fat can lead to serious health problems like heart disease, diabetes, and joint disorders. Measuring body composition provides a more accurate picture of your overall health than simply stepping on a scale or calculating your body mass index. Many older adults use BCA to keep track of their body fat ratio and markers for obesity. Scans only take a few minutes and use less radiation than you would receive on a commercial flight. One short, simple scan provides a wealth of valuable information about your health. You can map your lean, fat, and bone mass, see real body fat percentage, and identify your risk for metabolic diseases by measuring your visceral adipose tissue. That's the fat on the inside around your organs, not the muffin top that you can pinch. It's a fast and low-cost process that does not require a doctor's order, and results are available the same day. We invite you to take a new look at your health.